And this is Dr. Rockhold again with the third of 4 sessions on drugs of abuse. With this session, we're going to speak briefly about some unique opioid issues, and then we'll address hallucinogenic agents. In the lectures you've had on opioid analgesics, and coming up in opioid dependence and withdrawal material, you'll have more information on opioid abuse. The purpose of this slide is simply to highlight a number of opioids, some of which will be new to you, that reflect very recent trends in abuse of the agents. U-47700 is one example of a new class of synthetic opiates, referred to as non-fentanyl derived novel synthetic opioids, or NSOs. It is slightly less potent than fentanyl, and until recently had escaped DEA control as a chemically unique designer drug, which also was hard to detect on routine opioid drug screens. It and many other NSOs have now been recognized and are controlled as Schedule 1 agents. I think you already recognize that fentanyl and congeners are extremely potent opiates, have penetrated the drug abuse market widely, and are highly toxic. Tramadol, an opiate with monoaminergic activities, was originally believed to be free from abuse liability, but evidence of abuse is now known, and it is currently scheduled as a Schedule 4 compound. Methadone and buprenorphine, of which Suboxone is only one trade name, are used for medication-assisted therapy, or MAT, in opioid-dependent individuals. We'll talk more about that shortly. However, these two agents still maintain significant abuse liability, and they are widely available on the illicit drug market. Zohydro-ER is a long-acting form of hydrocodone that became controversial when introduced due to a potential for abuse. It's now a Schedule 2 agent. The question that regarded Zohydro-ER was simply, why do we need another very long-acting agent that has significant abuse liability? There are shorter-acting preparations of hydrocodone available for acute pain relief as needed. Finally, recognize that even preteens have been targeted for opiate abuse. Purple drank, or lean, are street names for a combination of codeine with a carbonated beverage, and which is sweetened even further with candy. Another particularly troubling opiate is dihydrodesoxymorphine, known on the street as crocodile. Crocodile was synthesized in the 1930s as a morphine substitute. It's somewhat more potent than morphine, and it has a slightly shorter duration of action than does morphine. Significantly for our discussion, you can synthesize it very easily from codeine using materials you can buy from any hardware store. This poorly controlled, unsanitary synthesis began to be prevalent in Eastern Europe around the time of the fall of the former Soviet Union, and it has since migrated into the United States. Because it is usually injected intravenously, the potential impurities and precipitates that can be found in illicit bathtub batches are known to cause infection and embolic ischemic gangrene and necrosis. The image you see is actually one of the least graphic images you can find on the web when searching for crocodile. Moving on, we'll look at another opiate of concern, and that is kratom, which is another name for a botanical, Mitragyna speciosa, that's been used for many years in Southeast Asia, largely as a means of minimizing withdrawal symptoms from opiate dependence. The active compound in kratom is believed to be a compound called mitragynine, which is an agonist at mu and delta opiate receptors. But in addition to that, it interacts with monoaminergic systems as an antagonist at serotonin and as an agonist at alpha-2 noradrenergic receptors. It's about 13 times more potent than morphine and has active metabolites that further increase its effects and the duration of action. Krypton, which you see on the right side of the slide, is a street product that has been marketed. It has kratom mixed with an active tramadol derivative, O-desmethyl tramadol. It's not been scheduled by the DEA as yet, but it is listed as a drug of concern. A number of states have individually outlawed the sale and possession of kratom already, however. Another non-standard opiate of concern is Salvia divinorum, an herb in the mint family. Salvia is native to Mexico. It's usually smoked, and when consumed, salvia rapidly produces sedation, disorientation, and often intense hallucinations. These effects are fairly brief, usually only about 20 or 30 minutes in duration. In animal models, it also seems to have analgesic and antidepressant activity. Salvia is unique in that it is the only natural hallucinogen that seems to act by means of highly selective kappa opiate receptor agonist activity. To date, it has not been regulated by the DEA and is thus a quote-unquote legal high. However, in Mississippi and in several other states, legislation has been enacted that makes it illegal to possess. So in Mississippi, it is considered to be a Schedule I agent. All right, moving on from kratom, we're going to begin to talk about other classes of hallucinogens. And this slide is just to give you a little bit of pharmacology history. What you see is a rendering of the bus called Further, in which Ken Kesey and his band of merry pranksters traveled from San Francisco across the United States to spread the word about the hallucinogen LSD, or lysergic acid diethylamide. In addition, that trip sparked the novel The Electric Kool-Aid Acid Test by Tom Wolfe. Lysergic acid diethylamide, or LSD, can be considered to be the prototype of the so-called classical hallucinogens, which act as serotonin receptor agonists. LSD is believed to increase serotonin release directly in the brain, as well as acting as a direct agonist at 5-HT2A receptors. And we believe it also has additional actions at both 5-HT1A and 2C receptors. Other prominent members of this class include mescaline from the peyote cactus Lophophora williamsii, psilocybin from hallucinogenic mushrooms, methoxydimethyltryptamine, or DMT, from glands in the amphibian like the Colorado river toad Bufo alvarius, and ibogaine, which is derived from a West African shrub. I've starred ibogaine on this slide because it probably has additional actions at drug receptors other than those in the serotonin family. As I'm sure you know, these agents are known for their ability to cause intense temporal and visual hallucinations. The subjective experience is highly contextualized, and it runs the gamut from euphoria to anxiety and panic. Sympathetic nervous system activation is also prominent with LSD. Mydriasis, tachycardia, increased blood pressure, sleeplessness, dry mouth, and tremors are all common. And while a psychological dependence syndrome has been detailed, there does not appear to be any physical dependence and hence no withdrawal, even with prolonged use of this class of agents. I mentioned the toad Bufo alvarius because of several peculiarities in its use. Most users access the hallucinogenic or methoxydimethyltryptamine by collecting and smoking or otherwise ingesting the skin secretions of this toad. That is, euphemistically speaking, sucking toad sweat. If you are interested, the link here takes you to a description of such an event. However, amphibian cutaneous glands are true pharmacology factories, and they also produce compounds that are classified as cardenolides or bufadienolides, which have potent digitalis-like cardiac effects. Unfortunately, just like it can be challenging to differentiate a psychedelic mushroom from a lethal one, one toad looks a lot like any other toad. Sucking the sweat from the wrong toad has caused serious toxicities and death, particularly in the southwest United States. You already have learned of the FAB fragment of an anti-digoxin antibody, Digibind, and this has been shown actually to be helpful in treating intoxication due to toad ingestion, particularly when the cardenolides are present in that particular toad sweat. The final group of hallucinogens we will present are those referred to as the datura-like substances. These have various botanical sources, including several plants from which antimuscarinic compounds like scopolamine and atropine are derived. These plants can be highly toxic, as you might expect. However, they also can produce characteristic hallucinations along with agitation, tachycardia, delirium, hyperthermia, and dilated pupils, all of which make sense from an antimuscarinic profile. The hallucinations tend to be delusional and often have animalistic overtones or offer the feeling of flying. These plants have been used for these subjective effects for many years in many cultures. Importantly to this group of hallucinogens, sedation, submissive behaviors, and anterograde amnesia are prominent aspects of intoxication with the agents, and they have been used in a variety of situations for criminal purposes. So, to summarize this session, please be aware first of emerging patterns of abuse, particularly the opiates. The COVID pandemic has dramatically increased opiate abuse and overdose, with even very young subjects becoming seriously ill. Second, the hallucinogens fall broadly into three categories due to kappa opiate receptor stimulation, serotonergic mechanisms, and by antimuscarinic actions. Finally, recognize that the drug underground often resorts to sources that are illegal or which have inadequate manufacturing protections. This can frequently result in intoxications that are severe or deadly. I appreciate your attention. The final session for drugs of abuse will follow. Goodbye.